Welcome back to the Hamilton Network. All of us are wondering these days just when will we see the end of provincial color systems, lockdowns, COVID waves, and ultimately this pandemic. No one has a crystal ball, of course, but Paul Minshull, the CEO and founder of Scarsin Corporation, says he's been able to gather together some pretty strong data of where this pandemic is going over the next few months. Paul, welcome. And let's start, first of all, with a quick capsulation of what Scarsin is.
First of all, Scott, thanks very much for having me on today. Have a great love for Hamilton. Did 2 degrees at Mac. On all of my family lives there. So, in terms of our company, Scarsin, we specialize in forecasting diseases, and we normally do that for large global pharmaceutical companies. And when COVID started, we made a decision to pivot all the resources and expertise we had to help Canada and public health decision makers.
Well, how do you forecast this stuff? I mean, what goes into a forecast?
It's definitely probably the most complicated forecasting we've done in 15 years. There's a lot of different dynamics, as you know, just reading the media every day. A lot of this boils down to us looking at how people interact on a daily basis. So it's kind of understanding how do people interact when they go to school and community and workplaces. And then in the model, we introduce the virus to see how it will spread based on how you change those. So as public health institutes changes in what people are supposed to do, the model is able to see that and then either increase or decrease the spread of the virus. And then obviously we've added in vaccines now to help protect people. But needless to say, it's very sophisticated. There's probably about 70 different things we're adjusting on a daily basis so the model can actually figure out what's going to happen with
Okay,
COVID.
so what are you seeing in your latest forecast? Where does the data say we're going at this point?
Yeah, I think our model probably is very consistent what I think with what you're reading in a lot of different articles by experts, and that is, unfortunately, we're most likely headed into a wave 3 type behavior. There's just some fundamentals that are kind of driving us there, and one is the transition out of the full lockdown with stay at home into a red, like in Hamilton, you'd be in red. So that causes people to kind of go out and interact again. And unfortunately, we're seeing the new variants, which are more transmissible. So those 2 factors are kind of going to drive some of the spread. And the vaccines are coming online, but unfortunately, there just hasn't been enough of them dosed to kind of hold things back. And, I think the question is, sorry.
No,
go ahead,
no problem
Scott.
at all. So you said the color systems and what have you, and going back out into the public drives this. Are we looking at another lockdown coming?
It's hard to exactly say this. I think, we can see right now that a lot of the public health regions in Ontario, they've hit the bottom and some are starting to rise again. As it turns out, Hamilton is one of those. The cases are starting to rise. It's tough to say how fast that's going to happen, but I think it's reasonable that certainly selected public health units in Ontario are probably going to rise to the point where they're going to have to go back into the gray, which you just saw recently with Thunder Bay and I believe the Parry Sound. So I think that there's going to likely be ones that go back into it. And depending on how many of them, that could again trigger something at the provincial level.
Okay, so you're rolling out this data for the province, for governments, what have you. And supposedly they should take that data and make some decisions with it in hand. Have the decisions that have been made so far the same decisions that you would have recommended given the data?
Well, we've gone through a lot of decision points, in the last year. Obviously, we went through a complete lockdown and kind of getting it under control. I would say, then the next major one was, opening up the schools. Anything to deal with schools is very tough because you've got a lot of counter things you need to keep in mind, the mental well-being of the students, the ability to keep learning. I would say, opening the schools we thought was a little risky in the fall. I would say probably the biggest one, though, is I think projecting the lockdown around just December 26th, giving it that 5-day window. And then what we saw in the data was there was a lot of, really strong increased mobility right before that, which really contributed to that really strong kind of holiday surge in cases. So, that was definitely a tough call.
Okay, so we're getting into a situation where, the vaccine is beginning to roll out. We're getting into spring, a little bit warmer weather. People are going to want to get outdoors and move around. Mm-hmm. How is this going to affect all of us, according to your modeling?
Yeah, well, I think first on the point of the vaccines, at this point now, there's very strong vaccination coverage with long-term care facilities and even retirement homes. And there's no doubt these two groups have been very significant contributors of the hospitalization. And it's not just going in, but how long they're in the hospitals and most definitely the mortality. So even with the small amount of doses dealing with them, it actually really does help the situation in terms of burden on hospital and the number of people that are likely to potentially die in wave 3. So that's a very positive development. And I'm sorry, Scott, your second one?
I was wondering, we're heading into the spring season. People are going to want to get out. Is that going to have an effect on what we see in terms of numbers going one way or the other?
Yeah, there's no doubt. Although I wouldn't say it's seasonal with respect of kind of disappearing, because we've clearly seen areas of the world where, they weren't locked down in the winter in their homes and they still had significant spread. You could look at the southern U.S. as an example. But there's no doubt it's beneficial for us in Canada when you can get outdoors at that. I think the unfortunate part is at the same time, there's some building positives around more vaccinations now that the supply seems to be coming in and the approval of the AstraZeneca. The negative is this growth of the variants is a very strong factor in the modeling. So in some ways, it's potentially overshadowing some of these other benefits we're going to get. And it's certainly one of the major drivers in the wave 3 growth.
Okay, so you're not ready quite yet to foresee another lockdown for sure coming. Maybe not. But based on the numbers and the data and what you have so far, what's the best advice that you are giving to your clients at the moment, to the governments and agencies that you serve?
Yeah, and let me kind of possibly backtrack a bit on the first one. I think that we are going to progress to a point where there are significant regions that go back into gray. If enough of them are there, it could actually trigger another provincial, more broader mandate and even possibly a stay at home. It really depends on how much those variants contribute to it. I would say, I will probably be much more certain of that, like 5 to 7 days from now, because we'll really start to get some good data on what's transpiring, because there's always a delay, right? There's always a 7 to 10 day delay in what's actually happening in infections and when you actually start to see it in the reported cases.
So as I say, quickly, your recommendations, your best recommendations?
I think, everybody's feeling the pandemic fatigue. I feel it myself. I had a transplant. I'm immune compromised. I'm a very high risk individual for not just catching this, but having serious disease. Everybody feels it, but I think we really need to still be very cautious for the next 30 to 45 days. I really see some major changes in dynamics after that, where the vaccines really start to gain critical mass, and believe that we'll have a very optimistic outlook after that. So when you start getting into the summer and in the fall, we're quite optimistic about major changes. So I think this third wave that we have in the next month or so, hopefully is the last major risk. I would say it's just be very cautious. Even though things are opened up, try not to do things you really don't need to do. Be very vigilant still on your masks and social distancing. It doesn't take a lot to rekindle this growth, and the variants will just accelerate it.
Okay, well, there is at least some hopeful news there. Thank you very much, Paul, for your time today.
Yes, thank you very much, Scott.
No problem at all. Now we continue to look at some of the unique community-generated content shaping our city with a continuation of Hamilton's Heritage Recognition Awards and the category focusing on the adaptive reuse of a heritage property.